All right, good evening, everyone.
No.
I'm Jennifer Pearson. I'm the Chief Brand and Advancement Officer at the Lindner Center of Hope. So glad that you all are joining us this evening. The Lindner Center has been doing these community education sessions for many, many years now, and we're excited to be continuing these. First of all, want to thank the Manor House for hosting us this evening at their facility. They're very generous in terms of their hosting. Also, thank you to our friends at Community Partners who assist us with the Zoom simulcast of this session. Without them, we wouldn't be able to reach as many people, so thank you for that. And then this is our 5th session of this calendar year of the community education series. But check out the schedule because there are 2 remaining. So if you're interested in joining us for those, we'd be delighted to have you. And then Lindner Center of Hope's mission is to provide exceptional mental health services and improve the health of our community. And education is one way we achieve that. Lindner Center of Hope has been in the community for 17 years and has served more than 54,000 lives. We are growing our services to meet community needs. We are a comprehensive mental health center. We serve all ages, really 2 and up, with inpatient services, outpatient offerings, neuromodulation, residential. So please reach out if we can ever be of assistance to you or your loved ones. And it's my pleasure to introduce Shay Little. She is an outpatient telehealth therapist, and she treats late teens and adults of all ages, genders, and sexual orientation. Her therapeutic approach is person-centered, genuine, and engaging. She enjoys creating a safe, non-judgmental virtual therapy space to meet her clients wherever they are. She has expertise in trauma and addictions and incorporates EMDR, CBT, DBT, and ACT into her mindful, body-centric, and holistic approach. Please join me in welcoming Shay Little. Hello. Okay. I'm Shay. It's nice to meet you all. I'm super glad you're all here tonight. I'm excited to talk about mindfulness with you, and I appreciate the friendly faces that are in the room that I recognize. Thanks for coming. Is there anybody in here who doesn't know what mindfulness is, like brand new concept? Okay, a couple people. All right, cool. So we'll talk about what mindfulness is not, why it's useful, and then how we can use it. That's our goal for tonight. And I'm gonna have to figure out how to navigate this and my notes, so bear with me. All right, let's start with this. Let's start with just taking a second. Oh, here we go. And we're gonna rate our stress level. So just in the moment in your own head, take a minute, 1 to 10, in this moment, what is your stress level? Just think about that. Okay. Now, take a few moments and just notice your experience right now. Notice your thoughts, what thoughts are occurring in your head. Notice your emotional state. Maybe you have a word for that in your head. What emotion am I feeling right now? Notice how your body feels. Any sensations you're having. And notice your environment. What you see, hear, smell, feel around you. Okay. All right. So whatever you noticed, you did it. That's mindfulness. It's just this idea of noticing, being aware in the present moment, non-judgmentally. So we're here, we're present, we're aware, we're not judging that. It sounds really, really simple. It's not as simple. I'm sure those of you who practice it know. So, kind of get into the nitty-gritty of exactly what this means, and then what are some skills we can use to practice. So longer, more detailed definition, mindfulness is moment to moment awareness of our present experience. It's non-judgmental, curious, and compassionate, and encourages awareness of any thoughts, feelings, or sensations we are presently experiencing. So what it is it's the idea that I am not in my head, that I'm here, that I'm present. That's all it is, which is hard. Think about how often during your day you're in your head, you're not here, you're experiencing something else, you're zoned out, you're on your phone, and you're not present. So again, I can't say it enough, the simplified definition, hopefully by the time you leave today, you've got this drilled into your head. It's being aware in the present moment, non-judgmentally. Talk for a minute about what it is not, because I think there are some myths out there about what mindfulness is. So it's not emptying the mind or the absence of thought. I think a lot of people think that it is the sort of this idea of meditation where we empty our mind and we're not thinking. It's kind of the opposite of that. Mindfulness is actually being aware of your thoughts, not emptying your mind. Also, I'm in perimenopause and I'm really sweaty, so if my glasses fog up, it's like, you can see me dripping buckets, that's what it is, nothing I can do about it. So it's not ignoring the thoughts, it's not changing the thoughts, it's not forcing the thoughts. So I think that's the other thing, we think, oh, I should be able to control my thoughts. I should be able to stop having this thought, or change my thoughts this. And while, yeah, that's a kind of a different thing, that's not mindfulness. Mindfulness is awareness of the thought. And maybe that will lead to being able to think differently, but that's not the end goal here. The goal is that I'm aware of my thinking. I'm understanding that I'm thinking that. So it's also not religious or spiritual. And I think that's important to note. It could be used in a religious or spiritual practice, but it's not fundamentally religious or spiritual. And then it's also not about feeling good. So again, I think we think, oh, this will make me feel better. That's not actually the end goal, right? It's to be aware, to be present, to exist in the world that you exist in. Not if this doesn't make me feel good, I'm not doing it right. That's not the goal. So hopefully that dispels some of the myths. Does anybody have any other questions about what it is or is not? Okay. Yeah.
More of a comment. I think sometimes I look around, like if I'm biking or walking, and I'm thinking about how everyone has earbuds in. So when you have earbuds in, and yes, I wear earbuds too sometimes. But it's like, I feel like there's so much we're missing because we just have those in our ears. So, I'm curious, like, are there more car accidents because of it? Because people are watching when they're crossing the street. It's kind of like having that phone in your hand. So when we're less aware, because we got so much stimulus from checking the time on our watch, checking on our phone, listening to this book. So just a comment more than anything.
Thanks. Yeah. Any checking. The more I'm checking, the more I'm not here, right? The more I'm attempting to be somewhere else. So I think you're speaking to this much bigger picture of our society now, and we want to distract and we want to disengage, and everything feels very overwhelming. And a lot of times we try to handle that by zoning out. And so this can be kind of scary to say, I'm going to pay attention, I'm going to be in the present moment. So it's something to think about. Can I do this right now? And if I can, that's interesting. If I don't feel like I can right now, that's interesting. That I'm feeling like I can't be present, that I need to have something to distract me, right? So even noticing that can be a way to be mindful, to get me eventually to a place where maybe I don't have to have the earbuds in as much. That's what we're working on, is just noticing. So mindfulness as a muscle. The idea here, Dr. Lori Bruce, some of you might know her. She used to be at Lindner Center of Hope, but she talks about it as a muscle. So it gets stronger the more that we engage it, the more that we exercise it. And I think that's just helpful to think of, that if we are using it regularly, we're gonna have
more of an ability to use it. If it's something I've heard about and I don't actually really figure out how to engage it in my life, it's gonna be a lot harder for me to put it into practice. It's not something I can just pull out when I think I need it. It's a way of life, it's a way of being. So one of the things that, she talks about is that studies show that regular mindfulness practice has been shown to increase the thickness of the prefrontal cortex, which controls our attention, decision-making, and emotion regulation, and reduce the activity of the amygdala, which is the fear center of the brain. I think that talks a little bit to what you're saying, that if I want to have attention and be able to engage in focus, then I need to learn how to be present. Again, it sounds so simple. So there are a lot of different ways to talk about mindfulness. I like the DBT model, and that's what I brought with me today. The DBT model is dialectical behavioral therapy. If you've ever engaged with Lindner Center, you've probably heard about it. We're pretty big about using DBT. But needless to say, what I like about it is that skills. So it's these tangible skills that I can practice or use to engage mindfully in the world. So we've got 6 skills, and we're gonna go through them and kind of talk about what they are, how to use them. And they really build nicely on each other and overlap a lot, so that's nice. So if we start with the first 3, the what skills, these are what I need to do to be mindful. So when I'm practicing mindfulness, I'm observing, which is noticing without trying to change. I'm describing, putting words on what I notice, and I'm participating. I'm fully engaged in the moment. So that's sort of what we get again at the beginning, right? Just sitting here right now. I'm observing. I'm observing what I'm thinking, what I'm feeling, what I'm noticing around me. I'm describing it. When I observe, language is how we think. So when I observe, I'm going to use language to then tell myself in my head, what is that, right? I'm noticing right now that my armpits are sweaty. Okay, right? The only way I can really observe is also to describe. So they go together very nicely. And then participate is just to be present. So to break those down, give you a little bit more on each of those. Oh, no, we'll stay right here. Okay. I will break that down verbally. So observe, right? Start by noticing our environment, our thoughts, our feelings, and our physical sensations. Keyword, without reacting to them, without reacting. So I don't want to notice a change, That's not the point. The point is just to notice. A thought's just a thought and a feeling's just a feeling. That's it. So I'm having a thought and I have the thought. It's really simple and it's also really hard. But I'm having the thought that X, and that's it. That's noticing, observing. And I'm having the feeling X. That's it. I'm noticing. What I'm not doing is going, I'm having this thought. Oh gosh, I don't like that I'm having this thought. I need to change this thought. Why am I having this thought? What's wrong? That's not mindful. Mindful is I'm having the thought that I don't like this person. Interesting. I'm having that thought. That's it. And then describing is that language that we use with it. So describing is interesting because we want to try to do it non-judgmentally, and we don't usually do that. We tend to judge everything in life. We're very prone to judgment, and judgment is good or bad. Judgment is this thing is safe, this thing is unsafe. This thing is right, this thing is wrong. This thing is good, this thing is bad. And we want to try to get out of that and just be present with whatever the thing is. So that's the difference between I don't like this person and I'm having the thought that I don't like this person. Thinking about thinking. So the other part about it is not to get caught in content, right? We get all up in our head. How quickly do we do that? Oh, I'm gonna be mindful. 2.5 seconds later, right? We're up in the content. And so the point is that we're just noticing what that is. And we're noticing our judgment. If I'm judgmental, I'm going to notice my judgment. Okay, I'm noticing the thought that whatever, now I'm hungry. Great. Now my next thought might be, oh, I hate that. Why am I hungry all the time? And then I'm going to notice that. I'm noticing that I'm judging myself for being hungry. That's it. That's all it is. It sounds like a big loop-de-loop in your head, right? But it really is just coming back to noticing. And we can talk about a couple different practices, to try to do that, to try to wrap your head around how to do that and not feel like you're circling. So participating, the word is participating, that's what they use. I prefer the word experiencing. Either way, whatever works for you, but I'm participating in the moment. Because I think sometimes we think that participating is a doing, it's an action. And maybe you don't see it that way, maybe that's just me. But for me, experiencing feels closer to what I'm looking for, which is that I'm present. I'm experiencing this moment with you guys. And that might mean I'm just sitting here, I'm not doing anything, but I'm experiencing this. Versus, again, I'm on my phone, I'm in my head, I'm already thinking about what I'm doing later, etc. So the other thing about experiencing is I don't want to hold on to what I'm experiencing, and I also don't want to push it away. And I think we tend to do one or the other. If what I'm experiencing, if I'm perceiving it as good, I want to hold on to it. I go, oh, this is so great. I don't ever want this to end. And if this is bad and I don't like it, I want to push it away. I want to forget about it. I want to distract. I want to put earbuds in. And we want to just be present with whatever that is. Because nothing lasts. And we can't make it last. And we also can't really make it go away. So we're just trying to experience it. Yes.
A few years ago, and maybe this is not called mindfulness, but when I would go into work, I really hated to be really bundled up. So when I got out of the car, I'd be like, wow, it's really cold. And I'd be like, yeah, it's cold. So I was trying to be mindful between my car and the building I was walking into. Not like, oh, I'm so mad, I should have got the coat. And it was interesting just how over time that it was not a big deal to get out of the cold get out of the car and to be cold for 10 or 15 seconds, because I was like, this was a choice I made. It's okay. We're gonna be in a warm building. But so when you're talking about a loop, that just kept coming to my mind.
Yeah.
Now I'm gonna raise my hand and just something about.
No, that's great. That's great. Yeah.
So it made it less painful because it was a choice I was making and I was just being aware of it.
That's it. And that's kind of the end goal, is to decrease suffering. Not feel good, but decrease suffering, right? And that's usually what we do to ourselves. When we get in our head, we create a bunch of suffering. Either about something that happened already that we cannot change, or about something that we think might happen that we're scared about, right? And as Bob up here said earlier, nobody's gonna die. It's okay, right? It doesn't matter if I'm in the cold for 10 seconds, nobody's gonna die, right? If I'm late, nobody's gonna die. So trying to have that mindset, okay, this is what I'm experiencing right now. And that's all it is. It's not, and then, and then, and then. So I think this is hard because we don't feel safe, but trying to experience whatever comes and not try to shape it, and not try to change the outcome. And that's a lot of, honestly, what therapy is being able to exist in our state of being, whatever that is, without thinking we can control the outcome of it. And knowing that we can't. And so then that really frees us up to have a lot more say and agency in our present moment. And if I'm thinking right now that I have to do a certain thing to make you guys get something out of this, I'm probably gonna have a bad time and you're gonna get less out of it. But if I just engage in the present moment with you, things are gonna go better. And maybe they won't, but I don't have control over that outcome. So that's another piece of this experience. Okay, so those are the what skills: observe, describe, participate. How skills. So this is how we engage mindfully. So non-judgmentally, the hardest one mindfully and effectively. So I'm going to start with one mindfully because it makes more sense in my brain, and I'm the one with the microphone. So one mindfully is this idea of doing one thing at a time. If you're reading, just read. If you're worrying, just worry. If you're conversing, just converse. We suck at this. We just do. We're really bad at it. And I think, yeah,
It's kind of because of like the hustle culture that we're in right now, that everyone's like, how much can I get done? And, you know, I think that's something that's interesting that I heard at Mayo Clinic, is they're like, can't multitask. You just can't.
did they say did they say more about what they call multitasking?
I forget what the word, I forget what's going, but they, I just like that they brought up that you can't multitask, and I'm like, yeah, well, yeah, you can. Especially
Hey,
if you have
Shay, you wanna
ADHD.
repeat for the people at home, a little bit of what she shared?
Oh, sure. Yeah, so she just shared that, what did you say?
Yeah.
Oh,
No
With the hustle culture,
multitasking.
Basically, they can't multitask.
yeah, is this connected to hustle culture, the fact that we're really bad at being one mindful and that we can't multitask? And what did you say about multitasking? Somebody said,
I said like monkey brain.
yeah, I like to think of it as task switching. What we can do is we can do a whole bunch of things in a row. But what we can't do is do more than one thing at a time. We cannot have more than one thought at a time. We think we are because our brains are really, really fast. So we have a lot of thoughts really quickly, but we're just having one at a time, one at a time, one at a time. Ask anybody with ADHD, will tell you, like, we can switch tasks all day long. We can't do more than one thing at a time. It's not true. And we certainly can't do it well. So there is this stuff about stimuli. How much stimuli do we need? Most of us are overstimulated most of the time. Most of us are in a lot of chronic stress or have been for long periods of life. So all of that stuff is gonna make it hard for us to be present, be engaged, do one thing. Because if I do one thing, what? I'm not getting enough done, right? Stuff's not gonna get done. And I could go on a huge tangent about productivity and hustle culture and why it's all wrong and why we all need to do less. But that's not why I'm here today. So I'll just say.
Made me think though, cause like we're sitting here and like, just like not what you're doing next, or not what's, you know. just
Yeah,
What are we doing right now?
yeah,
Just slow the brain down.
yeah, she's mentioning that we're just trying to do one thing right now and slow the brain down. Yeah. Yeah, and we're not gonna be able to do it all the time. We can't do it 24/7. We just can't. That's not the world we live in. So the idea is to try to build it into our life, not as a practice, not, 10 minutes a day, I'm gonna be mindful. But how do I bring it in as a way of being and activate my brain to think more like this regularly? All right, so again, like I'm setting an intention, I'm choosing to wear my earbuds or not, instead of I automatically have to and I don't feel like I have a choice. All right, so there's power in it. So, one thing at a time, and those things can be things that we don't like. One thing at a time isn't, I have to do this thing and I have to be happy about it. And one thing at a time isn't like, it has to be a thing that makes me feel good. One thing at a time is doing the dishes. However you feel about that. That's it. One thing at a time is experiencing grief. I'm just gonna sit in this moment, I'm gonna feel my grief, and I might hate it, and that's okay. So one thing at a time. And if you can't, that's okay too. You're just noticing that you can't. Right now, I'd like to do one thing at a time and I'm finding it really hard. I want to put my phone down and I'm noticing that I keep picking it back up. Isn't that interesting? All right, I'm curious. Isn't that interesting? I tell myself. So it does require a lot of practice and willingness. And that's not, if I practice this, I'm gonna see this linear progress and I'm gonna be good at mindfulness. It's not that. It's just, I want to continue to engage this way in life. And so I just need to be willing and keep trying. Keep trying. And sometimes it might feel easy and sometimes it might feel really hard, yes.
I'm a really visual person, so I have heard this analogy and it really depends on your age, but I think of a cassette recorder. Remember the old cassette recorders? And a lot of times they're on fast forward or rewinding, but really like mindfulness is that pause. Like it just, the tape is not.
Okay, so she gave this cool analogy that mindfulness is a cassette tape, not playing, not rewinding, but just paused. Just being right there in the moment. Yeah, that's cool. I also like to think about it as a car. I'm driving a car and I'm not looking 100 yards in front of me because I'll crash. All right, I'm not looking in the future. I'm not looking behind me in the rear view the whole time. I will absolutely crash. I've got to be here. All right, I'm looking just a little in front of me. I'm present. I'm not anywhere else. I'm driving this car. I'm right here. So I think that's maybe a little similar. I like that. Okay, now the big guns. Oh, same slide. Okay, we're staying right here. Big guns for me, non-judgmentally. So this one is so hard, non-judgmentally. I really think for me, this is where it comes down to this is just tough. And maybe some of you don't feel that way, but I think we're mostly judging ourselves all the time. We're judging ourselves, we're judging other people. And so the idea isn't to not be judgmental, because if you try to do that, you're probably gonna fail and you're gonna feel bad about yourself. The idea is to notice our judgment and then try to think in a way that is not judgmental. So instead of, oh, this microphone is really cool, I think it looks neat, that's a judgment actually. Or I could also judge it the other way, God, that thing is so stupid, why is it there? Instead of that, I can just notice it. I'm noticing that microphone looks like a bird. Oh, and it's got the word owl on it. Interesting. And it's a tripod and it's black and orange. So I'm just noticing. I'm just describing it as it is without putting my judgment on it. So this guy in front of me is driving 25 in a 50. I'm noticing that. I'm noticing that, right? And then I might notice other things. I'm noticing that my heart is beating faster and I'm feeling frustrated by this. You ever had the experience though, when you realize you're not upset? You have patience in that moment and you recognize that? That's also really cool, isn't it? So we're just noticing ourselves, because wherever I am in that moment is indicative of what's going on with me. If I can't handle this, probably I came into this car stressed and I'm upset, and it's nothing to do with this guy. All right, I don't know why it's a guy, I gendered him. And if I'm feeling calm about this person, I'm probably not in a rush. I'm probably feeling a lot better. I've probably eaten, I've probably slept. Things are going better. My body's probably not in a lot of pain. So I think when we are struggling with mindfulness, then it's an indicator, what's up? What do I need? What am I not getting that I need to take care of myself? Okay. So the other thing about judgment, I'll just say one more thing about it, is
Can
that when we judge,
can you? I wasn't sure if you could actually hear. Hi, my name is Matthew. I was
oh,
just typing a chat. I had a response or a question on the concept of being in the moment. Being as an RN in an emergency room, and but also as a paramedic, I can see where being in the moment as an RN is beneficial. Um, but as a paramedic, the theory behind paramedicine and what I was always taught and what I always teach my students is yes, you're in the moment as far as the paramedicine goes, you're in the moment with your patient as it deals with signs and symptoms, et cetera. However, you should be anticipating 15 minutes, 20 minutes down the road, what your interventions, what medications, what effect they might have on that patient, and then be ready to respond to either in a positive or, or negative as far as your intervention or what your assessment, your differential might have been with that patient. So I was just kind of wondering what your feelings on how that being in the moment, as it were, applies in paramedicine. Does that make sense?
it does. It does. And I think that, thank you for that question, because I think there are a lot of jobs like that or experiences we're in where we can't be one mindful. It's just not allowed. Like you're talking about that task switching. I'm doing this task while I'm thinking about what's gonna happen next. So I think parents can relate to that. That's what comes to mind immediately to me. And then people in other jobs where they're being asked to quote unquote multitask as part of the job. So I think what you're saying is there's a version of mindfulness that I might be able to use that's modified at work. And then how do I stay mindful outside of work so that I don't stay in that mindset of constantly preparing for the next thing, constantly thinking about what's coming next. I want to be able to turn that off when I'm not at work. Does that make sense?
It does. It's kind of funny because, and I guess depending on how long you've been, in emergency medicine, um, it's often you find that it becomes part of your life, as a routine, is anticipation on what comes next, et cetera, et cetera. And I can see where that difficulty arises on how to turn it off, so to speak. But like I said, and as you did mention, there's a distinct difference between, I think, professions, and that ability to be able to do that effectively, because it's something that, and I think that's also why, it could be why PTA, yeah, I always get it, exists in emergency medicine and first responders and things like that, because you're hardwired to think in that mode and it becomes part of your life the longer that you are in it. And also, too, the more effective you are on it. So, yeah, there is that fine line. I do agree with that there. Yeah, definitely.
Yeah, yeah, thanks for bringing that up. You mentioned PTSD too, and trauma is anything that overwhelms our nervous system. Eh, Whether we have PTSD from that trauma is a different conversation, but if I'm experiencing a lot of overwhelm of the nervous system all the time, then it's gonna be harder for me to, so again, this is another place where can I incorporate mindfulness in my life? So that I don't live that way 24/7, the way that I live at work. And then this actually goes right very nicely into effectively. Do what works in the moment. Do what works for you, right? So how I practice mindfulness might look a little different than how you practice mindfulness, and that's completely normal and okay. It's not a one size fits all, you have to do it this exact way. What works for me to stay mindful? So now I'm going to contradict myself and tell you that some people who are neurodivergent and who have a different level of stimuli that they operate in might actually need something. This is why I don't know if you guys have heard the word stimming, but some other form of stimulation to actually help them stay mindful. So for a neurotypical person, earbuds, I'm not mindful. There are people, headphones, earbuds, more mindful. They can actually focus more on whatever the thing is that they're trying to experience and be in the moment with. So there really is a lot of diversity in how you use this for yourself, yes.
I think a good example, which I didn't think about this years ago when I was working at the hospital, I used to feel like if I had somebody that was with the patient, they bring the patient in and maybe it's their son, and that son is sitting, hearing me question the mom, and their leg is like going up and down like this. I used to think, oh my gosh, they're so nervous. But as I've gotten older, I think it's a form of stimming that actually is making them be able to focus more and be more comfortable. So now I totally don't think of that gee, that person is nervous if I could see people doing that. And even like for myself, I mean, I could be at Kroger's, if I've got a pen in my hand and I'm trying to, concentrate, I find myself sometimes doing this or just doing this. And I'm not like nervous, but I think it's helping me to focus more.
Yeah, so I don't know if people at home could hear that, but she talked about being able to focus more if you're doing some kind of behavior like bouncing your leg or moving a pen, and how that can sometimes help us concentrate. So again, the idea is really simple of mindfulness. The actual practice of it looks maybe very different than sometimes how we describe it, to your point. Yeah, and I'm not, let's say I'm doing that. Let's say that I'm bouncing my leg. I'm not thinking about that I'm bouncing my leg, right? Probably don't even realize I'm bouncing my leg. So what I'm thinking about then is I'm listening really hard to this doctor because I really want to hear what they're saying. Bouncing my leg helps me to concentrate. That's your point? Yeah, perfect. Okay, so do what works. It helps us move away from judgment. The more effective I can be in this, the more I can move away from judgment. Again, the goal here is that I'm judgment free, but I can move away from the idea that I'm constantly judging first thing all the time. And then I can move away from the idea of good or bad, right or wrong. So things just are, they just are, and we have feelings about those things. But too often, and I mean, I'm super guilty of this, and we wanna judge them, we wanna label them as right or wrong. And what if they just are? Not everything has to be labeled as a dichotomy. Yes,
Question, so is kind of going back to like first responders. Is that kind of like why, like, is it anxiety that kind of like makes them like go the next thing, the next thing, the next thing? Is that kind of like feed in where they can't be more mindful because it, like, most of the, like, situations are more stressful for them?
so she's asking if with first responders, if the anxiety feeds into them constantly moving on to the next thing. And what was the last part?
Like, they just can't like, they can't like be in the moment, like,
They can't be in the moment so much because of the anxiety.
yeah, like they're the next, like the next thing, the next thing,
Yeah.
like they're worried, like, not, they have to be worried, you know, far in advance. But like, they can't really focus in the moment, you know, or
Right.
like, look behind, what could I have done better for said patient? And I don't know, like, even if that's just like critiquing themselves, or like, you know, they're kind of judging themselves in that way.
And she's talking about that they might judge themselves for, did I do that right? You know, so they're looking behind them, what did I do? They're looking forward, what do I need to do next? I don't know if anybody has an opinion on that. I'm not a first
Well,
responder.
so as a first responder, and that's something that, again, I think a lot of it, medicine is an interesting concept. It's see one, do one, teach one. And part of that mentoring process is to help, I think, people deal with or identify or um, adapt to circumstances that you're describing. So usually you're when you're in the moment, and I'm sure a lot of people who, especially if you're in a high intensity clinical environment, um, and again, the more experienced you are, I think, as well, that anxiety while you're actually doing it isn't so much there. It's almost like you're on autopilot doing what you need to do. It's like time slows down and you kind of go through it. What she was describing sounds usually what happens after the call. So usually, especially if you have a mentor or whoever's I guess, better equipped or better adapted to dealing with the circumstance that you may have had. We'll sit down, maybe while you're writing a report, and it's a debriefing, basically. It's like, what do you think about that call? Um, how do you feel about it? And then you get the response, if, what would you have done differently? It's not so much you're being judgmental, like what would I've done better? Well, if you could, what would you have done differently? And then you take basically this response and you go back and forth and you analyze based on the information given to either not to say confirm, but to identify the things that were done right and to possibly identify where improvements could be done. And that's that building process that goes on and on and on throughout your whole career, because I don't care how long you've been doing it, you're going to have circumstances where, what could I have done better? Well, again, if you get into that habit, which kind of goes in that mindful thinking aspect, debriefings are a wonderful thing to do afterwards, be it with your partner, because usually paramedics work in pairs, or in a group, fireman, paramedic, if you're back at the firehouse, and especially if you see someone struggling with a particular call. I mean, it's in the ER as an RN, I've been on calls where code was called, and you're in the room, you're working the code, you're doing what you need to do in the moment, and as an ACLS instructor, we're taught to, if you see something, if you see a mistake, don't wait. You're going to make that correction as it goes. All right. And then afterwards, you'll have that debriefing and you'll say, and it's not a negative thing. It's not, accusatory. It's just, hey, I know
Just trying
we
to understand
did.
like what happened.
Yeah, I noticed that, you wanted to do this. I was wondering what you were thinking, with that thing, because maybe there was something that they've experienced and it had a, great outcome or a different outcome than something that you would experience. And I think that's the great thing about medicine, because that's how we build upon our knowledge base. It's just
Right.
taking the negative out of it when you're asking a question or trying to, you know, correct, I guess, for the lack of a better word, if that makes sense. But I don't think, you're working in an anxiety in the moment, because that tends to lead to knowledge deficit, and that could be a huge problem in and of itself.
Right, thank you, I appreciate that. I think to frame that in a way where we talk about it as mindfulness. So after the fact, I'm gonna go back and I'm gonna notice. Oh, can you hear me? Okay, what I'm hearing, what I'm thinking, what I'm feeling about what just happened. So that's a reflection, right? And that's different than this idea of rumination and dwelling, where I can't get out of my head what just happened, but I'm noticing how I feel about it. And again, I'm having thoughts about what happened. Thoughts are thoughts. I'm having feelings about what happened. Feelings are feelings. And then I'm gonna go from there based on what I wanna do with those thoughts and feelings. So distractions aren't bad. Aha. So I really want to dispel this idea that mindfulness is meditation. Mindfulness is not meditation. Distractions aren't bad. So Dr. Lori Bruce calls mindfulness a deceptively simple concept. It sounds so easy, but it's really kind of hard. And she says the moment you notice you're distracted is the moment you're being mindful. It's the moment you're being mindful. So here's the way that I like to think about this. I like to think about it as if there's a train. And so here's me, and I'm standing on the side of the tracks and I'm watching the train go by, right? There's you. You're standing on the side of the tracks. You're watching the train go by. And the train goes for forever. Can't see the beginning of it. And the train goes for forever this way too. I can't see the end of it. And the train's going by, and each train car is a thought. So thought, 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 all day, every day. That's what life is. That's it. So my job, if I'm being mindful, what I'm trying to do is just not jump on the train. That's it. I'm just watching it. I'm experiencing it. Oh, isn't that interesting, that train car right there? Pink. I don't notice those very often. But if I jump on it, I have no control anymore. I've ceded my control now to that thinking. And so I don't have control over where I go, how fast I go. I'm there. Now, we're gonna jump on that train car like a million times a day. So our job is just to jump back off. Notice, aha, I notice that I'm in my head. I notice that I'm distracted. I notice that I'm on my phone again. Jump off, jump back off, orient yourself back to the present moment. Does that make sense? Okay, some people like to think of it as a leaf floating on a stream. So if that feels better to you, that's another way to think about it, is that I'm standing up on a little bridge and I'm watching a leaf floating down a stream, and that leaf is the thought. All right, so I don't have control over it. I'm just watching it. I'm not trying to control where it goes, what I do with it. Okay. So why practice a mindful state of being? And this comes back to a lot of the things we've been talking about. It reduces reactivity. If I'm mindful about what's happening, then I'm less reactive. I'm creating space between the thing, whatever that thing is, a feeling, a sensation, a thought, something in my environment, and my response to it. Because I'm taking that pause to be mindful and notice. So I have a little more opportunity there to choose my response and be less reactive. You're giving me a face. Does that not make sense? Okay. It increases focus and clarity. I feel like we've kind of covered this, but if I'm mindful, then I am definitely going to be more focused, and hopefully I'm more clear because I'm recognizing what's happening to me instead of just mindfully being there and zoning out or being in the reaction and not in the moment. Improves emotion regulation. Again, going back to the parts of the brain. If I'm strengthening my prefrontal cortex, I've strengthened my ability to regulate my emotions. That does not mean I'm going to have less emotions. I'm going to have all the emotions. I just regulate them. They don't get to take over. I strengthen self-awareness. This one's interesting too, because the more self-awareness I have and the more I can do that non-judgmentally, I can just sort of exist, right? And I don't have to feel ashamed for my existence. Cool, I recognize this about myself. Whatever this is, right? Something that you might perceive as good or bad, but it just is. And that's me. Okay, cool. That's it. and then builds resilience. So I can exist, again, I think it really decreases shame, and I don't know of any literature that says this, so this is just me saying, but I really think that the more mindful we are, we can build resilience and not live in guilt and shame and anxiety, but just sort of, again, live in our existence. So it's an awareness of our thoughts, feelings, and sensations and behaviors that then, if we want to, we can begin to change. But I don't think we're changing anything until we have that self-awareness and we do it non-judgmentally. Okay, so quick note on the nervous system. So there is some research that mindfulness can move us from the sympathetic to the parasympathetic nervous system. So that impacts how we manage stress and how our bodies manage stress. So the sympathetic nervous system is what we mostly call fight or flight. And the more emotional we are, the more upset we are, the more we're in fight or flight. We've activated that nervous system. It's all part of another bigger nervous system, but we're not going to talk about that. The parasympathetic nervous system, we call that rest and digest. I'm calm, I'm relaxed, I'm able to be in a calm state, rest, digest. I can't do that very well when I'm in fight or flight. Think about that. I mean, that's physiological, but think about yourself when you're in fight or flight. How well do you eat? How well do you sleep? So the sympathetic nervous system is activated anytime we perceive a real threat or just a perceived threat. And that's the thing, we go back to that amygdala we talked about earlier. If mindfulness helps regulate the amygdala is the fear center of the brain. So the more that that's unregulated, the more that that's overactive, the more we don't know what's a real threat and what's just stuff, life stuff, right? And so our brain and our body don't know, okay, I'm anxious because I think somebody doesn't like me is very different than, which, right, is just sort of made up fear in my head. Then I'm anxious because there's an aggressive guy screaming at me right there, right? Very different, but our bodies react very similarly. And so if we don't understand, if we don't have the ability to know, why am I feeling this way right now and what do I want to do about that? We can be in chronic stress all the time, and then everything feels like a stressor and everything feels like an alarm bell. So anything can make that sympathetic nervous system activate. Mindfulness can reduce how long we stay in that stress response. So I'm not gonna be stressed, we're gonna be stressed, right? That's gonna happen. When somebody opens the door and when you open the door and somebody yells, boo, from behind the door, if you're a person who jumps, I'm never gonna quit jumping. That's not gonna stop happening for me. What I can do is once that happens and I realize I'm safe, I can come back down to my parasympathetic nervous system. I'm safe, I'm good. I don't stay activated for an hour. Right? Does it make sense? Okay. So that's what it's trying to do. We're trying to just come back into a regulated state of being. Okay. So how do we do it? Here we go. While we often learn mindfulness through practicing techniques and activities, ultimately, it's a way of being. And I want to highlight that again because I think that we talk a lot about mindfulness practice, so it feels like maybe it's this thing that we practice, and it is, but it's really a way of being. All the practice is to help us sort of live this lifestyle, this mindful lifestyle. So now that we've talked about it for a while, let's notice our stress again. Just notice. Notice maybe how it's showing up for you in this moment. Notice where you feel it in your body. Where do you notice it in your thoughts? And then think about that. Where is it? 1 to 10. Okay. So what do we tend to want to do? We want to judge whether it went up or down, right? And there we go. So it's so obvious how And if you didn't do that, awesome, that's much more mindful. But if you did do that, if you got in your head for just a second there about, what was my number before? Did it change? Right, that's what we do. And then that's jumping on the train. Jumping on the train. And then we notice what we did and we just go, okay, well, that's interesting that I did that. And then I just kind of come back to now. So we can apply this formula to anything. So I can notice, I use stress so far, we've talked, but I can notice my pain, right? I'm gonna notice my pain without judgment. How's my pain showing up now? Where do I feel it in my body? Where do I notice it in my thoughts? And where's it at? I could do that with an emotion, sadness, anger, happiness. I could do it with an urge to engage in a certain behavior. Oh, I'm noticing, I really want a cigarette right now. You know, how's that showing up for me? Where's that at in my thoughts? Where do I feel that in my body? Mindfulness. So, who is familiar with grounding techniques? Couple people? Okay. Well, we'll do a quick grounding technique. And again, this is a technique to help us be more mindful. And it's a bad picture, sorry. So grounding is, again, another way to try to be present and try to use our senses to be present. And a common way to do it is this 5, 4, 3, 2, 1 technique. And it just goes like this. Name 5 things I can see. No? You? See that candle? See the phone? See the sweater? I see the owl. Name 4 things I can feel. Right? Or maybe you notice your butt on the chair. I can feel when I stop, I can feel the sensation of my feet and my shoes. I can feel that my arm is cold when I touch it with my hand. Right? Notice what you feel. Name 3 things you can hear. You guys got 3? Okay. 2 things you can smell. I find this one hard, but maybe some of you have really good senses of smell. And then name what you taste. So the point of doing this is to ground. I'm really more aware now of my present experience. And you can do this so quickly. This is the really good thing about mindfulness. If I could just give you one reason that this is awesome, it's free and you can do it anywhere. That's it. It's free, you can do it anywhere, and you don't need anybody to help you with it. So this is a really good technique. And all of these things too, we don't have any kids here tonight, really good for the kids. If you got kids in your life, do this stuff with them. Can really help them learn how to be present now. And they need it more than ever. Okay, so let's just go through ways to be mindful in your daily life. And I really encourage you guys as we go through these, think about, time is it? Ugh. Okay, think about maybe like 1 or 2 of these that you could really implement. If you're already doing some, awesome. If you aren't doing any, also awesome, because now you have the chance to try some. So figure out what's gonna work for you, and it might not be any of these, it might be your own version of this stuff. So starting with the morning, right? What can you do in the morning to be mindful, to bring that into your life? Before grabbing your phone, take a few deep breaths. And like, what does that mean, really? So like, let's just take 3 breaths together. Three deep breaths. Doesn't take that long, but it's long enough for us to pause and just be. So how do I do that, right? Interesting. How do I set that intention? Does anybody do that? Not get on their phone the second they wake up? Oh, how do you do that?
I basically leave it outside of the room and then, I leave it down, like, face down on the counter, or I try to, purposefully lose it, like put it where I'm gonna go in the morning. And even my husband here, he's in IT, so he has to be on call. And I'm like, can you just silence your phone? And he's like, I can't for work, but I'm also thinking that this is, what I just wrote on this paper as you're talking. I wanted to do like a morning routine together since he works from home, where we could just go walk and just be. And just look at nature and not do, like, not always really doing something.
Yeah, so she says she puts her phone down, face down in another room, so she doesn't have access to it when she wakes up. Okay, yeah,
I didn't even realize this was a mindfulness thing that I do, but I've got 3 dogs that sleep in bed with me, and that's probably why I don't sleep well. But every morning I wake up and the thing that I look forward to first thing is petting each one of them. All their fur's different. I'm like, Bean's really soft right here. Bodie's got some coarse fur, right? But I think about that.
that's
Each
awesome.
morning, pet all 3 of them. So there's your little
She just
pet
said,
dogs that keep you up all night.
as soon as she wakes up, she pets all 3 of her dogs and enjoys petting each of them, and they each have different fur. That's awesome. Okay, see, so this is figuring out what works for you, right? The other thing is just to notice the sensation of your body. Notice your body when you wake up. Notice the light in your room, maybe notice your breathing. Right? Notice if you're having thoughts, if you're feeling energized. And then again, that's without judgment. So it's not, oh, I'm so tired, my day is gonna suck. It's just like, oh, I'm noticing I'm really tired this morning waking up. Isn't that interesting? Nobody's gonna die. It's okay. Mindful shower. So the shower is where I zone out. It's where I do all my thinking, right? I don't know about you guys. So who can take a mindful shower and be present in the shower? Yeah. Yeah. But it'd be cool to try to just be present, feel the water, smell the soap, try to do that. And so for me, maybe I might do that for 1 second, and then I might do it until the very end. But again, those just noticing that I didn't do it is mindful. Aha, I noticed. So now in the shower again. Isn't that interesting? So instead of mentally planning your day, being in the experience. That would be the goal there, if shower mindfulness works for you. We do need time, I'll just say this, we need time to let our brains just like do stuff without us having to actively think. That's why we need rest, that's why we need downtime where we're not doing anything quote unquote productive in the hustle culture. So figuring out how you can do that too. What does that look like to wake up, sit in my bed and just be? Just think, just notice what thoughts come to mind. And I wonder how we can do that in the shower without being zoned out. It's an interesting question. Everyday activities, so eating, slowing down is a huge theme. Slowing down, putting your phone away, slowing down, putting your phone away, slowing down, putting your phone away. These just those 2 things, if we did nothing but those, we'd all probably be healthier. All right. And so for me, if I'm mindful, whenever I come back to my mindfulness, I usually realize I'm sped up some way. I'm speaking fast, I'm walking fast, my heart is beating faster, and I really usually accuse me, slow down, Shay. And then putting our phone away. And really, I mean, those of us who are old enough to know what life was like without phones, most people in this room, right? So we know what it was like to sit in the waiting room and try to go pick out a magazine, right? Or read Reader's Digest in the bathroom. We know. So a little bit more of that, not that I'm sorry if I was embarrassing, not that we need to go back. That's not what I mean, but how do I stay intentional? How do I stay mindful instead of completely zoning out? How many people, seriously, like you're on your phone and then you're like, how long have I been sitting here? Right? That's not an awesome way to live. If I am gonna do that, I wanna do that intentionally. I'm gonna take an hour and I'm gonna zone out. Okay, that's okay, you can do that. But what sucks is when we do that unintentionally. We don't know we're doing it. And then we're not usually very happy with ourselves afterward because it's not how we wanted to spend our time, our energy, our emotional output. Noticing, again, go back to eating. slowing down, putting your phone away, noticing your bites, actually savoring your food. Oh my gosh, who does that? Right? A lot of us eat in front of the TV now. And there's that, it's like the earbuds. I think the TV, for me at least, can be a lot like that. And then we don't even really enjoy our food. We think we did maybe, but we didn't really experience it. And we're not listening to our body. So noticing our food, enjoying our food, slowing down, actually chewing our food, which food today, a lot of it is made for us not to have to chew. That's a whole other problem. So if we don't go back to walking, several people seem like they've talked about walking, right? I think walking is a really, really good one if you can, if you have that ability. Not all of us can, but walking without rushing. So this could be purposely taking a walk, or it could be as I'm going about my day, I'm noticing my walking, I'm engaging with my walking, right? I want to actually just walk. Why do I need to walk in a way that is all about the next thing? So I'm walking, feeling my feet touch the ground, I'm listening to sounds around me. My mind might drift, I return back. My mind drifts, I return back. No, and the sounds is interesting. If you can do that, amazing. If you're in an environment where you can do that, maybe you're walking and the only place you can walk is somewhere that's really loud. And it's not very pleasant to listen to the sounds. Maybe you don't have a lot of tolerance for that. Wear the earbuds and then focus on the thing that you want to hear, right? Maybe you can do that. So again, figuring out what works for you. Chores, oh man, this one. So, mindfulness is taught, if you're doing the chore, do the chore. Just do the chore and think about the chore, be present in the chore. I don't know. If that works for you, fantastic. What we don't want to do is mindlessly do the chore and do 18 other things at once. So if I'm doing the chore, if I'm doing the dishes, I love to listen to a podcast while I do the dishes. All right. But what I'm not doing is doing the dishes, trying to listen to a podcast, and then also answering people on my phone and responding to people constantly in my house asking me questions and thinking about what I'm going to do next. I'm just, in this case, doing the dishes and listening to the podcast. So I think there's a way you can be mindful sometimes that maybe isn't pure one mindfulness, but maybe it is for you. So think about yourself. How do you do that? Right? What makes this not that we're going to do it mindlessly, but we're going to do it effectively, and we're going to do it in a way that we're intentional and still can be mindful in the activity. Does that make sense?
Do you feel like it's harder for folks that are neurodivergent to be mindful?
I think it's harder for folks that are neurodivergent to be mindful, but I'm a neurodivergent person. So I don't know.
What is neurodivergent?
Neurodivergent that's okay. It's usually it's a way to talk about people who have ADHD or autism. Yeah, yeah. So it's just kind of the idea of not neurotypical. Yeah. People who have a lot more distraction in their brain. So how can we use it emotionally? So emotionally is where I think we want to use it. I think that's what we often think about with mindfulness. So if I'm upset or I'm anxious, again, taking that pause, taking that breath, noticing the tension, naming the emotion, instead of avoiding it, instead of going, I'm fine, I'm not angry, I'm fine, right? How am I actually feeling? It's okay to have feelings. We're allowed to have feelings. They're not unsafe. And then let it be there. Just let it be there without needing to judge it or immediately act on it. I'm having this emotion, noticing this really strong emotion. I just had a trauma response because a kid threw a ball at my face, and I have a history of somebody breaking my teeth out. And so I'm noticing that, right? And I want to try to notice it before I act on it. Just notice. And it doesn't mean that I'm not allowed to have that experience. It doesn't mean that I am wrong for having a trauma response. It just is. And then mindful communication. Oh man, if we can work on this, the world would be such a better place. So before replying in a conversation, pausing. Also really hard for us ADHD people, but we try. Truly listen, not just wait for your turn to speak. So when we zone out when somebody's talking to us, I think the mindful thing to do is notice it and say, hey, I'm zoned out. Say that again. I want to hear you. All right. And if I'm noticing myself in my head, wanting to wait, just wait for them to finish, what's that? Notice. That's interesting. I'm not listening. Huh. Wonder what that is. Be curious about it. What's that about? And then noticing body language of somebody else, tone, and how they're feeling. So, if I'm observing you and you're talking to me, I'm gonna have a lot more information about our conversation than if I'm in my head, looking away, waiting for you to stop talking. So examples of incorporating mindfulness. Oh, end of day, last one, end of day. So mindful reflection. This goes back to sort of the, hey, what was that like today that I experienced? How do I want to think about that? What do I still need to sort of process about my experience? Maybe it was a really hard experience. If I'm an EMT, maybe it was something with my kid, who knows? But when did I feel present today? Just noticing that. And then what distracted me? And if I'm aware of that, that helps me to be able to just notice how I'm doing. Maybe notice what I need to change or want to change to take care of myself better, or what's going well. And then jotting down things we're grateful for. That's a great mindful activity. If I'm aware of my gratitude, and that is not ignoring the hard stuff, it's just acknowledging the gratitude. So examples of practices that incorporate mindfulness, hopefully you guys have been exposed to some of these. So these are all practices you can do. Breathing exercises, guided imagery, body scans, that's noticing my body, right? So maybe starting at the top of my head, working down my body, just noticing the sensations in my body all the way down to my feet. Progressive muscle relaxation, which is the tense and release, right? So I'm gonna tense and release it to learn how to relax muscles because it's hard to do. For some of us, grounding techniques, which we did earlier, the 5, 4, 3, 2, 1, and then mindful meditation. There it is. So mindfulness can be a part of meditation, but mindfulness is not meditation. So, where are we with time? Indulge me. And just for a minute, we won't do all of this, but this is progressive muscle relaxation. So I like this because if I don't know, if I tell you relax your face, just relax it, just do it. And maybe you can, maybe you can't. But that's hard. It's hard to do it with just a verbal cue. But if I first tense it, so if I tense my forehead, I lift my eyebrows and I hold it like that and really feel that tension. And then I release, I can feel the sensation of relaxation. And I know what that feels like. And I can train my body. What does it feel like to release that tension? I could do the same thing with my jaw, right? I can hold my jaw open and really feel that feeling. And then when I release, I can feel what it's like to relax my jaw muscle. So if you haven't done this before, show of hands, who's done progressive muscle relaxation? Yes, yes, awesome. If you haven't done it, I highly recommend it. Very, very good way to, and what's great about this too, is it really helps you focus. You're listening, you're paying attention to what you're doing next, you're counting, you're moving your body. So it's really easy to stay engaged and mindful with this activity. Okay. So key points to remember. Mindfulness is a way of being. It's about building your capacity to stay present with whatever is happening internally and externally. Capacity to stay present, right? Tolerating whatever is present. It's not meditation, but meditation can be included in mindfulness. Mindfulness can be included in meditation. You guys know what I mean. Mindfulness can be practiced outside of clinical settings and used in daily life. So again, I think making sure that we dispel this idea that maybe it's something that I only do in therapy or I only do in a certain setting. This is something we want to incorporate into our life, make it a way of being. It's not magic. I think that was pretty obvious. It's actually kind of hard, but it can help us manage emotions, reduce fear, increase calm, and feel more in control. And it's not something that we go, oh, I'm mindful, I'm good. Don't need any conventional care. it's a tool that's used in conjunction with care. So we're not gonna say, I'm mindful, no therapy ever for me, don't even need a doctor. Definitely have good blood pressure because I'm mindful. Go to the doctor. And also, use mindfulness. So it's not about changing who you are. Not about changing who you are, it's just about becoming more fully present. All right. Any questions?
Very good. Yes.
You have a child that can get really stuck in their emotions. When or how would you practice the mindfulness with them? I assume you don't do it the first time when they are in the middle of a crisis. I would assume you need to practice specifically the one where you notice 5 things, or is that something you would do in a moment of calm ahead of time?
Well, we're talking about this idea of how upset if we're in green and we're already in parasympathetic nervous system, rest and digest, we can do these things. We can really practice these things. If we're in yellow, so our nervous system is activated, our fight or flight's a little activated, it's a little bit harder. But if we practice them while we're in green, easier to use in yellow. If we're in red, right, and I'm having a panic attack, this is hard. This is hard. So the goal is, if I'm doing this all the time, maybe I don't go to red so often because I'm practicing staying in green and yellow and coming back down sooner. And if I do get in red, maybe I can use this and I'm not in red for as long, or what happened while I'm in red isn't as awful, right? So it's by degrees, but yeah, practice regularly, make it a normal routine, a normal way of existing, a normal way of managing stress, so that they know, so that when they are in red, you can then say, hey, all right, what are 5 things and they know what that is and they can do it. Make sense? Yeah. Cool. Anybody else?
I think breathing is the key. I've got a grandson that's 4 and he's very smart, his brain's clicking, you can see it.
Yeah.
And when he starts to get too many things that he's trying to tell you, I'll just say, take a deep breath, take another one. And then you can just see in his eyes that he's like, okay, I'm grounded now, I will tell you. But breathing, I have worked in the last couple of years that it doesn't so much center you, but it does, but it also brings you back. And if people would just stop, if they don't have to, just 2 or 3 deep breaths, and you can feel that there are people and nobody's gonna die.
Yeah, that's exactly right. She's just talking about the benefits of breathing and how grounding
I
it
don't
is.
think a lot of people do it nowadays. I mean, it's just something that they think takes too long or it just doesn't work, but just anything, even, any kind of a daily,
Breathe while you're driving the car, right?
yeah.
Breathe while you're doing the dishes.
I had the back door open today, there was no sound, no birds, no nothing, and I thought, wow. And you take a deep breath so you can take it in and think, wow, but just to take a couple deep breaths really helps. That people just don't stop to do anything.
Yeah,
They're going through breathing, but they're not taking the time just to do that.
yeah. We're not breathing intentionally. We're not aware of our breathing, right? Yeah, yeah. And anytime, I mean, absolutely, 100%, breathing is the foundation to all of this. 100%. Probably most of us in here know that. Yeah. Anything else? Anybody else have thoughts or questions?
You did a great job, thank you.
Well, thanks.